COVID-19 cases in the United States climbs to a staggering 40 million amid a fourth wave that continues to spread. Hello, I'm Anand Naidu and this is The Heat. The number of coronavirus infections in the U.S. has reached another grim milestone, 40 million cases, more than 10% of the population contracting the virus since the pandemic began. 3 months ago, the number of daily new cases had dropped to around 15,000, but with the highly contagious Delta variant, we're now seeing over 160,000 new cases confirmed every day. To discuss these numbers and what can be done, let's bring in our panel. From Connecticut, William Haseltine is Chair and President of Access Health International. Also from Connecticut, James O'Day is Vice President of Operations at Hartford Healthcare's Behavioral Health Network. Peter Chun-Hong is a professor of medicine and an infectious disease specialist at the University of California, San Francisco. And here in Washington, D.C., Rafael Bernal is a reporter for The Hill. Welcome to all of you. And Bill Haseltine, let me start with you and let's look at some of the numbers. New infections are up 156% in the U.S. from Labor Day last year, and hospitalizations up 158%. And of course, these numbers are being blamed on the Delta variant and of course, people who are still refusing to get vaccinated. What is your assessment of what is going on right now? And does this mean that efforts to overcome this pandemic is going to take a lot longer than we initially expected?
Well, to start with your last question, the answer is yes. It's obvious this is not over by last summer, which people hoped. And it's going to be quite a while, I think, many years before we finally put this back into a manageable pandemic. That's the first point. Second is, it's both the virus and people's behavior. It's not the virus alone. It is relaxation of many of the strictures that we operated under, social distancing, mask wearing. And despite the fact that we have very good vaccines, there are a couple of things that have been going on. One is a fair portion of our population in regions, many regions, are not vaccinated, even though they could be. But beyond that, there's behavior which is relaxing. And that means the virus has an opportunity. The virus is more dangerous than it was before. It's more transmissible. Delta is not the virus we first encountered. You need shorter exposures. Doctors are saying you get it quicker, you get it more seriously, and more younger people are getting it. So it's a different virus. And we can look forward to other viruses, unfortunately, that have some of these same characteristics, different mixes of characteristics. So it's a witch's brew, but it's not a good one. And we're really suffering.
And Bill, when you say we need to get to the point where the outbreak is manageable, what kind of criteria are you looking at?
Well, I think it needs something that I've called multimodal COVID control. That means vaccines first and foremost for the eligible population, hopefully soon including our children down to the age of 5 and then down to the age of 2, so most people. Secondly, that doesn't mean we can stop our mitigation measures. Even with vaccines, this virus is kind of like the flu. It will get around most of our vaccines one way or another. And for the last 6 months, I've been studying its various methods. It's not just the outside of the virus. It has many opportunities to change, as do other viruses, to become more transmissible and more deadly. And it's moving along that trajectory. Then, of course, we need very strict mitigation measures. We need to do identification, contact tracing, and isolation. We need to keep up our warp speed research for new vaccines and new drugs to prevent transmission. We know that we can take care of vaccine-resistant viruses or viruses that don't, for which we have no vaccines, by prophylactic chemotherapy, but we need to ramp up our research to do that. And then, of course, we need international cooperation. We can do better on every one of those boxes. Every country can do better on every one of those 4 or 5 things I've just mentioned. And I think over time we will. And above all, we need something which I call a culture of caring. We need to realize that restrictions on our own freedom are for other safety, and restrictions on their freedom is for our safety. That is a deep cultural change. I'm afraid it's going to take a while to come.
James O'Day, great to have you on the show. Another issue that we're hearing a lot about these days is booster shots. We know that the effectiveness of some of these vaccines starts to drop, and then that leads to the likelihood of people needing booster shots, especially those who have weak immune systems. But now experts are saying that the White House needs to back off booster shots until more data is available. Here is the White House Chief of Staff, Ron Klain, speaking over the weekend. Let's listen.
I want to be absolutely clear. No one's going to get boosters until the FDA says they're approved, until the CDC Advisory Committee makes a recommendation. What we want to do, though, is be ready as soon as that comes.
So, James, what can you tell us about the need for booster shots, and ultimately, will everyone need that?
Well, first off, thank you for the opportunity to be on the show, and I agree with so much of what Bill had to say. Well, I think it's still early, frankly, for us to be talking about the efficacy of booster shots at this point. I think we're still waiting on additional information, especially as it relates to both the Pfizer and the Moderna and the J&J vaccine. I actually think there's a different approach that we need to be taking rather than focusing on the booster shot for those who have already chosen to be vaccinated. While that will offer protection to those individuals who have already moved in that direction, I think we have a much more compelling issue in front of us, which is the fact that we've plateaued across this country and in many countries around people getting an initial vaccination. And as Bill points out, that is probably one of the most important issues, is getting people vaccinated along with the social behaviors and the masking and the other things that Bill mentioned. And I guess I would go so far as to say that the plateau is concerning. And I think the science that we have at this point about the efficacy of vaccines is so abundantly clear. And yet we still have so many people that are choosing not to be vaccinated. I think we need a new strategy. Just as Bill was saying, we need a new strategy to think about this as a chronic condition and not one that's going to go away in the near term. I also think we need to approach people who so far are choosing to not be vaccinated and to engage more deeply with them about what is their hesitancy about and how do we support them in the choices that they're making, because those choices affect all of us.
Yeah, but James, I'm guessing that, one could come up with very reasonable, cogent, scientifically based arguments for the need to be vaccinated, but this has been politicized to such an extent in many instances. There's an ideological battle going on here, so it makes that job very much more difficult, doesn't it?
It's an excellent observation, and that is actually what I have focused on over the course of the last 2 to 3 months, is engaging with people to better understand that reality. And it's true that there are identity issues, there are political issues, there are also very significant issues around race and different communities that are responding around the vaccination question in very different ways. As a psychologist, one of the things that I know is that it's very important for us to listen to those realities. And I think we're past the point where we're simply going to debate with people and talk past each other. The value in a person like me or other scientists saying, please go get vaccinated, please go get vaccinated, that's gotten us exactly where we are. And so those individuals who were receptive to that approach have already been vaccinated. I think we need a new strategy that engages people with a much more generous attitude and a willingness to really listen to what is their resistance about and how do we help them maybe get to a place if through listening to their reality, they might begin to contemplate a different approach.
Peter Chin Hong, great to see you again, Peter. You are out west in California, one of the most populous states in the country. What is the situation out there?
Uh, we have a higher proportion of folks who have received one shot, at least 80% right now in the state. And of course, in certain areas like where I'm at, San Francisco County, about 80% have received two shots, and Marin County as well. I think what we're focusing on now is really having some of the invisible population also approached, because again, the people we count up as the denominator isn't only the people who should be receiving vaccines. For example, today there was an initiative outlined where there's a grassroots organization looking at day laborers. You know, we don't count them even as part of the denominator. So I think that is the approach. And I agree with the others. We have to have a new approach of, you know, listening to people, humble inquiry, I think, finding out where people come from. I was struck by a recent survey showing that only 17% of the unvaccinated were approached to talk about vaccinations. Speaking from my own experience, we sometimes treat them as other and not engage, and I think maybe an engagement might be worthwhile.
And Peter, what can you tell us about the situation in schools? Because there's quite a vigorous debate going on, not just in California, of course, around the country about young pupils returning to school, in-person teaching, the debate over mask mandates, etc. There was a survey done by a New York-based tracking agency which shows that 1,000 schools in 35 states remain closed. And we know that there's been an increase in the number of emergency room visits as well as hospitalizations for teenagers aged 17.
Well, I think a lot of the school debate has been political. A lot of it has been centered around masking. And of course, we know in the UK, for example, the students going to school are not masked. So people are looking at that. Of course, it's just one of many strategies that we are listening or using in schools. I think what has really shaped the school debate too is the mayhem it's caused. A lot of folks have been pulled out of school for contact tracing, quarantining, and that's led to some disruption. But if you look at the hard outcomes of hospitalizations in highly vaccinated areas like San Francisco, in my own hospital, for example, we probably have 4 kids that are hospitalized. And I think the idea that, or the fact that 1% to 2% of kids who are under 12 get hospitalized is really something that I think people are not really communicating as well.
Rafael Bernal, the situation in schools has led to a bit of a battle between states' rights and federal rights right now. In fact, the Biden administration is investigating up to 5 states that have banned mask mandates on the grounds that it violates children's rights. How is the White House handling this? Something that's become overtly political right now.
Well, I think broadly speaking, the medical realities, as very well explained by all of your other guests today, they paint a grim picture for Biden politically. COVID-19 was the reason that Biden's poll numbers during the first 6 months of his presidency sustained a pretty high level. That has gone away, and attention has gone on to other maybe crises. The White House pushes back on the idea that maybe Afghanistan isn't really a crisis, but a situation that they're dealing with, and they have a point. But COVID and the economy seem to be where voters are. So it's given an opening for Republicans to push back on the issue where Biden was strong, and that's what's happening with the issue with schools. And it's happening with the issue of not being able to for example, convince people in Mississippi to get the vaccine. So you have very different realities where, like they were talking about the San Francisco Bay Area, 80% are vaccinated. In Mississippi, I believe the number is about half that. And you can't govern a country like that. You can't create policy, like an overarching policy, and add on top of that Republicans in many states, and many very populated states like Florida and Texas, are trying to do whatever politically is least convenient for the Biden administration, and politicizing a medical issue even further. And you know that I don't think the Biden administration has had a good answer for that either, because the result is people are put in danger, and neither side of the political debate seems to have the answers to get either more people vaccinated or somehow reduce contagion or get mask mandates or the behavioral. There are simply no answers that are working right now.
Rafael, as we heard from our other panelists, there needs to be a different approach right now, especially when talking to people who are not vaccinated. We've heard President Biden on many occasions in his addresses to the nation, in his White House appearances, calling for unvaccinated people to take the vaccine, to get the vaccine right now. But is it time perhaps for this administration to try a new approach?
It has to be. I think it's actually sort of uplifting to listen to the medical experts on this panel talking about new approaches, talking about having a conversation with people who have not been politically engaged to do something to save their own lives. You know, that the science, the Biden administration has not been able to sell the science to that group. And then there's a group, you know, there's the group of people who support the Biden administration and have been sold on the science in this case. And then there's that group in the middle. And I think the risk is, of course, the people who haven't listened, they maintain themselves at risk. And as the virus mutates, apparently that risk is getting higher. And that group in the middle, if they start losing them, if booster shots become necessary and people don't want to take them, for instance, people who did get that's the worst case scenario. And frankly, it's a very possible scenario. So that's the real danger. And the Biden administration has to figure something out, some way to reach across the aisle that actually works. And frankly, if they do, everyone in the political world will be very surprised.
Bill Haseltine, yeah, go ahead. Go ahead.
And I'm sorry, if I may, you know, I thank you for that comment, and I very much appreciated my colleague in San Francisco use the term humble inquiry. And we've talked so much about the science, which is the infectious disease science, and the epidemiological science, which is very clear. But there's another form of science that would inform our strategy to engage with people who have been disengaged. And cognitive science offers us a way forward, which is, again, entering into an inquiry with a genuine sense of curiosity, with a genuine sense, actually, of generosity, and really wanting to understand what is leading someone to adopt the position that they're in. The science is very clear. When we engage with people in a generous sense of really wanting to understand where they are, they actually become more ready to contemplate a different approach. And so I think cognitive science is something that we need to enlist a bit more of as we think about how we move people from being in a contemplative place to possibly taking a step toward getting vaccinated.
Bill Haseltine, I want to get back to the variants for a moment. Dr. Ashish Jha of Brown University, he's the dean at the School of Public Health there, he tweeted this. He said, worried about the MU variant, maybe Lambda. How about C12? While we are still learning, doubt they'll displace Delta, and our vaccines should hold up fine. I don't lose sleep over new variants. I worry about people's fatigue with the current one. What do you make of that?
Overly optimistic, to put it mildly. If you made that same statement when the Alpha variant was around, you would have regretted it. He will regret that statement. These viruses have the potential to change, and the potential to change can make them very much more dangerous. Now, we don't know the future for sure, and I could be wrong. I haven't been wrong so far in the predictions I've made about the dangers of this virus. We've underestimated it from the very beginning. And I go through 15 different ways we've underestimated it. It's a really big mistake. But I think I'd like to say something about what the other panelists have been talking about. And from my point of view, the issue is a deep cultural issue. Do we actually care for one another in this country? Yes, we do if there's an emergency like 9/11 or a hurricane. Everybody chips in, both Republicans and Democrats, and everybody are helping the Afghans, refugees that come into the United States. That's our strongest suit. But when it comes to something like this, I think the only way we're going to get to a better place is if we suffer enough to know that we have to change. And nobody knows when that will come. Yes, we can listen to people, but there are people who are hard-headed and don't even want to be engaged. So engagement isn't the only way. It is an important way, and I agree with my colleagues on this panel. But a culture of caring, it might take 1,000 years to develop or longer. I don't think we have time to do that, but we have to somehow understand that I am my brother's keeper, and my brother is my keeper. That's what we have to get to, and we are so far from that today. And any help that our friends in psychology or neuroscience or any of the fields, because they're absolutely clear. Science is clear. Vaccines help. Mitigation measures help. Wearing masks help. All those things are important. The science is really clear. And on the vaccines, a third shot helps. It definitely helps for people, especially my age, where the immunity is waning and people can get reinfected and get rehospitalized or hospitalized again. So the facts are there, but it turns out that humans are not fact-based decision makers. We're emotion-based decision makers. And we make decisions in groups, not only by ourselves. And we have to engage people at that level. And how we get from where we are to where we need to be is really distressing. When I see a country like China that's had fewer than maybe 24 people die in the last year and a half, and we're heading toward 800,000 people dead by the end of the year, it is heartbreaking. All those people who didn't have to die because our culture is callous and uncaring and selfish.
James, I'd like to get your thoughts on that. You know, you were talking a moment ago about cognitive science, but you know, as Bill points out, there are deep cultural differences, deeply entrenched cultural differences in the country that has polarized us. And you know, this debate right now over whether one should get vaccinated or not has become part of that cultural war, hasn't it?
It's certainly true, but I think at this stage, you know, we're at the time where leaders have an opportunity to engage. And I've been deeply heartened actually by many of the very individual conversations that I've had with people where I've entered with a genuine sense of, I just really want to understand what's leading to this, your hesitancy to become vaccinated. And I've had many people look at me and say, you know, do you really want to know what I have to say about this? And we've engaged in very, very heartfelt conversations. I've had many persons, Black Americans and nursing professionals that I work with closely, who have echoed things that happened in the Tuskegee experiments back in the 1930s and 40s, which parenthetically, those experiments, which were the most awful, heinous things, went on until 1972. So this is not ancient history when this was happening. And my experience has been when you genuinely get into a conversation and really explore what is leading a person to, at this point, choose to be hesitant to become vaccinated, I've been very impressed by how many people, when really genuinely understood, have actually said, can you tell me a little bit more about your perspective on this? I think that's a way forward that we need to do much more on.
Peter, getting back to the variants that we were talking about, is there a risk that unvaccinated people could become incubators for even more virulent variants if they continue to refuse to get vaccinated?
Well, Anand, the maxim goes every 2 weeks there's a new variant being created, but only some of them rise to the ranks of the rogue gallery of variants. So the more transmission events you have, the virus is not precise enough to make an exact copy of itself every time. So yes, transmission occurs with wild abandon in the unvaccinated groups, more proportionally speaking. So that group is going to be the incubator for new variants.
Rafael, it would appear that one of the big problems that this administration is facing right now is the huge amount of disinformation that is floating around, especially on social media. Is the White House making any kinds of efforts to approach the big social media companies like Twitter, and Facebook to try and control and regulate this disinformation that's getting around?
I mean, there is regular communication, just like with other large industries. But I think it's pretty clear that there's not enough. There exist bad actors locally, both nationally and internationally, who are trying to disseminate more misinformation. Plus, there is mis and disinformation that is created sort of organically, if you will. Not with the purpose of damaging, but it is damaging. So you have an ecosystem of bad information, with two ecosystems of bad information, and certainly the government is not doing enough to stop it. Again, it's a matter of creativity. There's no game plan on how to stop misinformation in the internet age, because the internet age is still relatively young. But that is part of the role of government, is to invent those techniques. And the big question that this entire panel leaves me is, I don't know who it is who is the appropriate vector to give out correct information to different groups, to African Americans who are reluctant for historical reasons, to people who are reluctant for political reasons. I really don't know if that answer exists at this point.
All right, let me put that question very quickly to Bill Haseltine. Bill, I've only got about 60 seconds left, but should there be one central authority that determines what's right and what's wrong?
That's a very profound question. It's not so much determines what's right and what's wrong. Does a government have central authority to stem a crisis such as this? It seems to me that a lesson that we can all draw from this is that our public health services are in dire need of restructuring. Now, the problem with that is, if we had a central government with power over states and Trump was the president, we would be even in worse shape than we are today. So there is a very strong argument that says decentralization under a bad leader is much better than centralization, even if sometimes you get a good leader. And it's a debate that we have to engage in and we have to understand. And it depends on people, not just central politics, to make sure that we put this epidemic behind us. People have to care for each other as they want others to care for them.
Okay, and that's where we have to leave it. Thanks to all of you for being with us. That is it for this edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for watching.